In. Perfect. Hi, my name is Joanne Oport. I am the co-founder and president of Africans for Mental Health, and I'm also a commissioner in the state of Maryland. I serve on the Commission on African Affairs. I'll be the room monitor in here, and I'll introduce our speakers in a few. They'll have an amazing presentation. Just as a caveat, any sessions we have in the auditorium are recorded, just so we can make sure that those who are not able to make it can learn a little bit about what you're learning. So we're in here sharing, and you're part of the sharing effort that we have for this conference. If you are on social media, please hashtag NAMI MD Educate. We need to be trending, viral, everything is about social media, correct? So anyway, without further ado, we have two speakers, as I mentioned. Their names are Keirstyn Silver, and she is a director of the Maryland Employment Network, a program approved by the Social Security Administration to provide ticket to work services. In her current role, Ms. Silva continues to work with multiple supported employment programs across the state of Maryland, providing guidance on the Ticket to Work program. She strives to educate others about employment as a cornerstone of recovery. Ms. Silva began her career nearly a decade ago in the public behavioral health system and has worked as a benefits counseling specialist, program coordinator, and program director in a large multi-site supported employment program. During this time, she developed expertise in supported employment services and witnessed firsthand the positive impact that work had on recovery. Ms. Silva has a bachelor's degree in psychology and is a certified psychiatric rehabilitation practitioner, as well as a community partner work incentive counselor. Our next presenter who is working with Ms. Silva is Ms. Mabel Munoz. She has been serving her community for over 6 years, assisting individuals with disabilities in achieving financial independence. She currently serves the Maryland Employment Network as a benefits planning specialist, where she provides her close collaboration with community partners like you and individuals like you with disability. She offers experience in crisis counseling and employment-centered case management, which have enriched her abilities and skills as a benefits planner. Ms. Munoz's proficiency writing and speaking English and Spanish allows her to provide bilingual services to the community. She has a degree in psychology and is certified as a community partner work incentives coordinator through Virginia Commonwealth University. So I ask that we engage, we participate, we tweet, and we learn. Thank you.
All right, good morning, everyone. Can everyone hear me okay? Okay, awesome. All right, so thanks for coming to our session this morning. Things we're gonna learn today. We're gonna talk about the impact of work in recovery, if it's something that you're not already familiar with. We're going to learn about the programs and supports available for individuals seeking employment. A lot of times people are really interested in working, but they don't know, or they know that they need help, but they don't know the resources out there. And there are a surprising number of resources available. And when you leave today, you will have information on how to access those. And then we're going to talk about how work and benefits interact and how the system actually does promote work. A lot of people feel like benefits are a big barrier, which we'll talk more about in a little bit. But the system really is sort of designed to help people in going back to work and ultimately not having to worry about their benefits anymore, not having to rely on their benefits anymore. So first, we are going to start with a little pre-test as far as what you already know. So first pre-test question, Social Security beneficiaries don't work because of fear of losing benefits. Do you think that's true or false? True. Definitely. All right. Oh, thank you. Which of the following is a barrier to employment that many encounter? Psychiatric symptoms, social skills, lack of resources, or all of them? Good. All right. The 4 major dimensions that support a life in recovery are health, oops, I'm in the way, health, home, purpose, and community. Good. You guys are good. All right. Is this me still? No, it's you. Go ahead.
All right, so now let's ask some questions about Social Security benefits. Social Security beneficiaries can't work at all. Okay? Beneficiaries do not have to report earnings to Social Security when working. Okay? Title II Social Security beneficiaries have 9 months to test their ability to work without it impacting their benefits. True? Okay. Social Security beneficiaries are impacted differently when working depending upon the type of benefit and the individual's earnings. Okay? A ticket to work is an actual ticket that allows Social Security beneficiaries to work without impact to their benefits. All right? Which one of the following is not a service provided by supportive employment? Oh, okay, sorry about that. Job development and placement, job coaching, transportation to and from work, long-term employment support. Okay.
So that's tricky.
Yeah.
Good. All right, so we talked a little bit about it already, but why don't people work? Just yell it out. Absolutely. What else?
Can't get employment due to records.
Oh, good one. Yeah, comes up a lot. What else?
Need help with the process?
Absolutely, yes. A lot of people are interested in working but don't know where to start. Anything else you guys can think of?
Might have health challenges along the way that interrupt their normal life.
Absolutely, yeah. Anything else anyone can think of?
They're worried about staying balanced, like being able to maintain a job and keeping their psychiatric symptoms stable.
So that's kind of like fear, right? Yeah. There's a lot of fear associated, I think, with going back to work or entering the workforce even for the first time. The fear of losing benefits, whether it's the cash benefit or the medical benefits. Sometimes people, I've heard a lot actually, like, Keirstyn, I don't care about losing my check necessarily, but I can't lose my Medicare or my medical assistance because I can't have my insurance, I can't get my meds and visit the doctor, and then I can't work, and I'm back to square one, right? About fear of failure. Anybody ever or has anyone ever been afraid to try something new because you weren't sure if you were going to be good at it? I know I have. Yeah. Nobody likes to feel like they're failing at something. But if we don't try something new, we'll never know, you know? And then fear of stepping outside of the comfort zone. What do you think that means? Yeah, right. Like if I'm okay, if I've got my routine where I get up and maybe I talk to my mom on the phone and then I clean my house a little bit, if I have to interrupt that routine and go out of my comfort zone by going to a job interview or going to a job, that's scary, right? Humans, I think, are by nature creatures of habit. So we don't really want to, you know, rock the boat if we don't have to. So any other barriers to employment? Hang on some of these for a second. What other barriers do you think? We've talked about fear, we've talked about criminal records, we talked about health. Any other barriers? Lack of resources, I think. Yes?
How about worried about the employers wondering if you have difficulty, if they're going to understand?
Yeah. What about just afraid of like being judged by your employer? Yeah. Anything else? Any other barriers? Yes, back there. Absolutely. Logistical barriers. Anybody, I know this is like a statewide conference, anybody from outside of the Baltimore, D.C. area, maybe out towards Western Maryland or on the Eastern Shore, Harford County, public transportation out there, right? Nothing. So I've worked in Carroll County and Harford County, and even beyond that, once you get further than just like the 95 corridor, nada, nothing. Any other barriers we can think of? Yeah, Again, with that stigma, man, every time you turn on the television, it seems like there's something that has happened, and people are very quick to say, oh, that person was mentally ill, right? It doesn't do anybody any favors, because it just further perpetuates the stigma, and it makes it more difficult for people to get jobs. When we in this, I know I'm preaching to the choir, but we in this room know that someone who is suffering from a mental illness is far more likely to be the victim of a crime than the perpetrator of a crime, right? But again, when popular culture and the media present it that way, it's easier to understand why some people have that. Doesn't make it right, but when you turn on the TV and you see it, you're like, oh, I get why people think this, because that's what they're being told. Any other barriers? Yes? Mm-hmm. Uh-huh. Mm-hmm. Oh, wow. I thought you were going to say that they were worried that he was going to, like, you know, have an increase in symptoms or something like that, but not being convenient for them.
It gets in the way of their second medication.
Oh. All right. That's an interesting one. It does. That has come up. Yeah. Yeah. All right. Well, yes. Treatment providers. I've had some therapists say to me, oh, this person can't work. They'll have a nervous breakdown. What? Or I had a psychiatrist tell one of the individuals I was working with one time, you have to quit this job. You know, you're not doing well right now. You have to quit your job. When in reality, the time that the person was most comfortable and doing the best was when, or feeling their best, was when they were at work. And they were distracted from everything else that was kind of going on in their lives. All right, so we have psychiatric symptoms. Now we can kind of put them up there. What about difficulty with ADLs, activities of daily living? So sometimes people have trouble with, you know, having clean clothes to wear, maybe doing laundry regularly, or taking that medication without the assistance of residential staff. And then when people are unable to do that, that does present a barrier to obtaining employment. Thinking about if you don't have clean clothes to wear and you go into a job interview, what's that employer gonna say? No, thank you. No, we went with another candidate. Social skills. A lot of times people, especially maybe if they have anxiety, have difficulty interacting with employers, potential employers or their current employer, or their coworkers even. So that can kind of present a barrier in either obtaining employment or maintaining employment, right? This is something that we haven't talked about yet. What about active substance use? I feel like that would present a barrier. Yeah, I think could be hard to get up in the morning if you are really hungover from the night before. Or if you're in withdrawal from some other substance, that would be very difficult to get to work. I'm sorry, meds themselves, yeah, there's withdrawal symptoms, side effects from meds themselves, oh, absolutely. We've talked a bit about stigma already. Justice involvement. Sometimes when people are going through a rough time, we know they don't make the best decisions always. Not everybody, but it does happen, and that does sometimes create a situation where someone has had a run-in with law enforcement. Excuse me. Oh, coughed right into the microphone. I'll try to go to my right this time. And some employers are understanding of that when you go in and you say, well, this happened 10 years ago. I was not at a good point in my life, but these are the ways that I've changed since, and that's kind of what supported employment programs will coach people on doing. Other employers are like, no thank you, we can't, or they can't hire someone who has certain charges for particular reasons. So somebody who maybe has a theft charge may not get a job working with the cash register, right? Because that employer could have some reservations about it. So the justice involvement can create a barrier. What about intermittent work history? Like on and off. Maybe somebody had a job for 4 years or so. Symptoms increased, or maybe they had like a first episode, and then they didn't work again for 2-3 years. That's going to be a pretty big gap on the resume, right? And employers, when they're looking, will say, I wonder what was going on during that 2-year period. Now, they can't ask you really, like, were you in the hospital or were you sick? But that will certainly throw up a little flag for employers. So something that supported employment programs talk about is kind of how to explain gaps in resumes.
Or like being fired,
Yes, absolutely. If you've had 6 jobs in the past year and none of them lasted more than a month, whether it's due to symptoms or being fired or just not having motivation, which that could be a symptom of a psychiatric illness, that would definitely be a red flag for an employer because they're thinking, well, what's going on that this person isn't staying at jobs for more than a month and a half at a time. I'm glad this came up. Limitations imposed by treatment professionals. It happens. I think that a lot of times people really they have good intentions for the most part. Now I have to do meds at a different time now sounds a bit selfish to me. But as far as people saying like, your symptoms are going to increase, this job isn't good for you, whatever. I think people do have good intentions by saying that, but really it's placing a barrier on people that isn't fair to them, right? Because everybody should have the ability to choose what they want to do for themselves, especially in terms of their recovery. We're going to talk in a little bit about how recovery, I'm sure everybody knows, is very individually driven. And if work is a part of that, everybody deserves the opportunity to work. Somatic health concerns. A lot of times, somebody mentioned the side effects of psychiatric medications. So like, I believe Seroquel comes with an increased risk of diabetes, I believe. And then with diabetes comes a whole host of other symptoms and things like that. Now, if your blood sugar is through the roof or very low, and you have to go to the hospital, or you have to stop and grab a snack real fast, or take your insulin or something like that, and your employer's like, what's going on? That could be a problem. That's okay. You get a sneak preview of what's coming up. That could present a barrier in and of itself with obtaining employment. Lack of resources, so not knowing what assistance is available for assistance with finding a job. Also, what am I looking for? Like the material resources associated with looking for work. So pretty much any job you're going to apply for nowadays, they're going to say, apply online. Well, if you don't have a computer, how are you supposed to do that? I mean, you can go to the library, but if you don't have public transportation in your area, how are you going to get to the library? Which falls under logistical barriers, which is the next one. Other logistical barriers, what about childcare? Childcare, insanely expensive, so expensive. So you have to have somebody to care for your child while you're looking for a job, right? Because you got to go out and interview and everything like that, but you have to pay that person unless you are lucky enough to have a family member or a friend who's willing to help you. So you don't have the money to pay that person so that you can go make money to continue to pay that person so that you can work, right? It's like a vicious cycle. Lack of support. Any family members in the room? Family members? Okay. So when your loved ones are feeling like they might want to have a job, you're like, oh, I don't know. You might be. I don't want to overgeneralize or make assumptions. But sometimes family members are like worried about the fear of failure on that person's behalf, or worried about the public benefits, which we are going to talk about in much more detail. But that can create a barrier because somebody says, well, I want to work. And mom's like, ooh, I want you to do what you want to do, but I'm really worried about, what might happen with your health when you start working, and that can sort of, that can create a barrier sometimes for people. So just keep that in mind. There's also a cultural ambivalence sometimes, especially with younger folks, TAY population sometimes. Why would I work? I want to stay and have fun with my friends. All my friends are going to the movies today. I don't want to go to a job interview. Blah. So teenagers or culturally, or young people in their 20s may have a cultural ambivalence to working. Also, certain like neighborhoods or friend groups, that sort of thing. It's kind of like, well, you're going to go try and work, but you think you're better than the rest of us? Like, that can create this sense of, oh, no, I'm not going to do that because I don't want anybody to feel like I am trying to, rock the boat as far as our group goes. And the myths surrounding work and public benefits, which, again, we're not going to talk about right now, but we will get to. So did you know that 2/3 of people with serious mental illness want to work, but actually only 15% or so are employed? And only 2% of people who could benefit have access to supported employment services. So I believe now in Maryland, just about every county has access to supported employment services. If not all of them, just about all of them. But people don't know how to access them. They don't know that they're out there, or they might be like, what is supported employment? Like, I don't even know what that is. So we're going to talk about that too. Of course. Serious mental illness is typically defined as, in terms of eligibility for services. Let me start with that. To be eligible for supported employment services, somebody has to have a serious mental illness, and that is defined as bipolar disorder, major depression, schizophrenia, and all of the various, like last episode, depressive, et cetera, and borderline personality disorder, as well as like schizotypal and schizoaffective disorder. Okay. That's not to say that somebody who has PTSD or generalized anxiety disorder or anything like that wouldn't experience these similar or same barriers. In terms of supported employment, that's what the criteria is for eligibility for the service. There are some supports available for individuals who maybe don't have one of those but do have PTSD or something else, and we'll talk about kind of how to get access to doors or ticket to work in the meantime. Okay. So knowing this, why work? So these are some things that we've heard that people say, like why they do want to work. Financial wellness, obviously. Who doesn't want more money? I mean, literally, we all want more money. It doesn't matter what your job is. If your boss is like, hey, do you want more money? You're going to be like, yeah, I want more money. Relate to social norms. Typically, adults are expected to have jobs. Family upbringing, my mom worked, my dad worked, my grandma worked, I want to work too. Need to feel productive. If you don't have something productive to do with your time, you start to feel kind of bored and useless, right? I just got back from maternity leave. I cannot tell you how many times I vacuumed my rug. Just when the baby was asleep, I didn't have anything else to do. I wanted to feel like I was accomplishing something, so I vacuumed because I wasn't feeling productive when she was sleeping. But if you don't have a job to go back to after maternity leave, that could be an ongoing sort of thing, right? So people need to feel productive. Needing structure, something to do every day or every other day. Getting up, a reason to get out of bed, right? If you don't have a reason to get out of bed, I probably wouldn't get out of bed. My bed is really comfortable. It's warm, it's really cold out today. I think this is like one of the coldest days we've had yet. So having to have a structure, something to sort of do. Personal sense of fulfillment and accomplishment. Wanting to feel like you've done something that matters. Something that matters to you or matters to other people, finding meaning. And feeling needed, valued, and appreciated. Hopefully everybody has a good boss who values them and appreciates them and appreciates all the work that they do. That can really help people to kind of feel that. Okay, so we'll switch gears a tiny little bit and talk about recovery and how work sort of fits into recovery. So this is something that probably everybody has already heard. The definition of recovery per SAMHSA. A process of change through which individuals improve their health, wellness, live a self-directed life, and strive to reach their full potential. So with that, they have identified 4 major domains that support a life in recovery. Health, overcoming and managing one's disease as well as living in a physically and emotionally healthy way. Home, a safe and stable place to live. Purpose, meaningful daily activities. Job, volunteering, family, school, that sort of thing, that give people the income, independence, and resources to participate in society. And then community, friendships, relationships, coworkers, supervisors, people that are going to provide support, love, hope, someone you can call when you're having a bad day. I mean, that's what it boils down to. So how does work fit into all of these? It's a little bit counterintuitive sometimes, I think. But studies by Dartmouth and Purdue University have actually shown that having a job decreases the symptoms of psychiatric illness as well as active substance use. So I mentioned earlier how substance use can be a barrier to finding employment. And while that is certainly true, having a job can actually help to decrease substance use. If I have to get up tomorrow and be, tomorrow's Saturday. So if I have to get up on Monday and be at work at 9 o'clock, am I gonna drink 6 beers on Sunday night? I'd hope not, you know what I mean? So maybe Sunday's another bad example, but because you're not at the game. So Monday Night Football, you know what I mean. So anyway, but you have this reason to not actively use anymore, right? And I've seen it firsthand. I have worked with individuals I worked with a gentleman once who wanted to work at a restaurant, and he had a history of alcohol use. Everybody was like, don't put him in a restaurant. He's going to go behind the bar and drink. He really wanted to be a dishwasher in a restaurant. So we ended up helping him with that, and we're like, provide support, we'll keep an eye on him. He didn't have any problems. Being around it didn't really bother him because he knew he had to be reliable. His supervisors loved him, his coworkers loved him. He wasn't even tempted because he felt appreciated, needed, he liked his job, he enjoyed interacting with people. It wasn't an issue. So it actually helped him to decrease his substance use. Home. So most government assistance programs provide income, bless you, that is lower than the federal poverty level. I think the federal poverty level is a little over $1,000 a month right now. And the maximum amount of SSI that someone can get per month is $771. So already, imagine trying to pay rent on that, right? So it's hard to find a safe and stable place to live when you're living on $771 per month. Additionally, somebody may be in a residential program, and they have staff coming in to help them with their medication, and they've got 3 roommates. They don't feel very independent there. It might be stable, but it's not independent for them. So they want to be able to move out, live a little bit more independently, live on their own, not have a roommate, or maybe move out of mom's house and be independent. Having an income opens up options for housing and home, right? All right, where are we at? Purpose. We've talked a little bit about this already, but having a reason, really, to get up, right? I think that purpose goes even one step further. When we are helping people try to find jobs, we try to help them find something that they actually care about. So not everybody is going to work at McDonald's because some people may not care whether or not somebody gets onions on their Big Mac. That might not matter for someone. I used to work, side story, I moved to Baltimore in the middle of the recession, the last recession, and I took any job. I took a job at a car dealership, and I thought, well, okay, this will be, how hard can it be at selling cars? Really hard in the middle of a recession, first of all. Second of all, I didn't care if somebody bought that car at all. Like, people are like, oh, this car's okay, but I also kind of like that car. And I'm like, well, whatever, dude, you gotta drive it, not me. So anyway, that job lasted a week. I really wanted to help people. So then I got a job in public housing where I felt like I was helping people to get housing, and I stayed there, and here we are today. But it was something that I cared about doing as opposed to something that was just a paycheck. People, when they feel like they have a purpose and a meaning, are more successful. And then community, we talked about having the opportunity to interact with others, make friends, have someone to call when you're having a bad day. If anybody has had a job in the past, you know that that is a great place to make friends, even meet a partner, a romantic partner. A lot of relationships start in the workplace. Don't start any drama with it though, because that sometimes comes too. But employment, having that opportunity to get out and interact with people as opposed to being at home is paramount to recovery. Or even being at like a PRP where you see the same people every day. Getting out, getting to see new people with different life experiences, that helps to kind of enrich people's lives. So, in the interest of time, I'm not going to have everybody write them down, but what are your goals and aspirations? But like, what's your life goal? Be happy. Be happy, that's a great one. Yes, and happiness might look different for you than me, than you, you know what I mean? That's awesome. What else? Excellent, that's a fantastic goal. Anybody else have a life goal that they would like to share? Mine is to have a comfortable retirement somewhere warm. Are you gonna?
Yeah, balance work with health.
Yeah, excellent. It's a great goal. So let's compare. When we talk to, it says professionals or family members, but we'll say people who aren't living with a mental illness. These are the goals we hear. Buy a house, get married, go back to school, be happy, that sort of thing. When I'm working with folks and I look at their treatment plans that are created by employment specialists or therapists or anything like that, these are the sort of goals we see on their treatment plans. Attend the PRP, take my meds, take my shower, maintain my part-time job, improve my social skills, blah, 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 blah. Not to say that these things aren't important, that people don't necessarily need help with them. But when we sit down and we think about what our ultimate goal is my ultimate goal really just to attend the PRP every day? Or do I want to buy a house? Or do I want to the married and that sort of thing? So it's just kind of important to keep that in mind. Additionally, looking at this side, what's the professional family member side, work fits in to all of these goals, right? In order to buy a house, you have to have money. You have to be able to pay your bills and show the bank that you're going to pay them back. If you want to get married, weddings are expensive, first of all, but if you want to get married, your spouse is probably going to want you to have a job so that you can help contribute to the household. Saving for retirement, again, you've got to have money if you want to save for retirement. You've got to support children, you know what I mean? So work really fits into all of these goals that are listed here. So when you're thinking about work, just kind of keep in mind that it can be a stepping stone to other things. Or for some people, work might be the goal itself. I want to have a good job. That might be my ultimate goal, and that's cool. But even if it's not, try to think about how work may fit in there. So I'm going to hand it over to Mabel, who is going to talk a little bit, actually a lot of it, about what it looks like for somebody's Social Security benefits when they go back to work.
All right, guys, so let's talk about money. Part of my role, or most all of my role as a benefits planning specialist is to talk to beneficiaries about how working is going to impact their Social Security benefits, what work incentives they have available, and how to utilize them. How many of you guys have heard they want to work, but they're afraid to work because of fear of losing their benefits? Okay, or I can only work part-time. How about I can only earn $1,000 a month before they cut off my benefits? Okay, these are a lot of misconceptions that I hear as a benefits planning specialist. So today, I want to give you a very basic overview of how working is going to impact benefits. Do you guys know that there's two different types of benefits, right? Do you often hear people kind of mixing up the rules for each one? Okay, great. So we'll go over each one individually and the rules that each one has. So SSI is supplemental security income. That's one of the benefits that an individual can receive. And the other one is Title II benefits, which consist of SSDI or a childhood disability benefit or a disabled widow or disabled wife. The source of payment for SSI is general tax revenue. Whereas for Title II benefits, it comes from a disability trust fund. For both of them to be eligible, you must meet Social Security's disability criteria. For SSI only, you must meet income limits and resource limits, whereas for Title II, you must have contributed into FICA. Or a parent, exactly. If you're getting just pay taxes into Medicare and Social Security. If you're getting a benefit off of a parent's work record, then the parent would have had to contribute into FICA.
So when you get your pay stub and you see your Social Security and Medicare taxes coming out, that's being contributed to FICA.
Got it. All right, so SSI comes with Medicaid, whereas Title II benefits come with Medicare. This consists of Part A, which is hospital coverage, Part B, which is primary care coverage, Part C, which you don't really hear used too much around here, but it's Medicare Advantage, and Part D is prescription coverage. Now, SSI, like I said, is based on income a lot, so it has a $2,000 resource limit, whereas Title II benefits don't have any resource limits. So by the end of each month with SSI, the individual can't have more than $2,000 in their bank account. So as I mentioned earlier, both benefits have two completely different ways that they're impacted with earnings. For SSI, supplemental security income, as soon as the individual starts working and earning, that SSI check is going to be reduced. SSI is meant to be supplemental income. Whereas for SSDI, or another type of Title II benefit, it's either all or nothing, and that depends on what phase the individual is in. And we'll talk about phases in the next slide. So Social Security Disability Insurance, SSDI, or another type of Title II benefit, as I mentioned before, gets a series of phases that the individual is going to go through when they begin to work. These phases are also known as work incentives. The very first one is called a trial work period. Social Security gives individuals receiving Title II benefits 9 months to test their ability to work, and during those 9 months, nothing will happen to their benefits. They can earn any amount of money. Now, the individual will only use a month if they earn over $880 in gross wages, so before taxes are taken out. Let's say the individual found a part-time job and is only earning $700 a month. For that month, they will not use a trial work period month. So those months do not have to be used consecutively. Okay, they actually have a 5-year period to use all of them. So I've met individuals that maybe found a summer, like a seasonal job, and worked 3 months, so they used 3 of their trial work months, and maybe the following year they worked another 3 months. So that's just an example of how they can use them, or they can work a full-time job and use all of them at once. Now, as soon as they're done with their 9th trial work month, they're going to enter their next phase. This phase is called extended period of eligibility. Now, this phase is 3 years long. And this one is consecutive. So once they started it, it keeps going. And during this phase, Social Security is looking to see if the individual can earn substantial gainful activity, SGA. How many of you guys have heard of that? No? Okay. Well, substantial gainful activity is what they're looking to see if the individual is able to earn each month. This year's amount is $1,220 in countable income. So anytime the individual earns over $1,220 for the month, they're not going to be due a SSDI check. But let's say the following month, their earnings fall below that SGA amount. They will be due a check for that month. So they can kind of go on and off getting a check for those 3 years, which is neat. So a good example would be if a beneficiary found a job, they're working over SGA, they're not going to be getting a check The first time they earn over SGA, however, they're going to get a grace period of 3 months. So essentially, they have all 9 trial work months to get their check. Then they have 3 additional months, which is their grace period. And after that, if they are still earning over SGA, that is when their benefit is going to be suspended. That is gross. But Social Security counts it as countable income because there are a few deductions that could be deducted. One of them is impairment-related work expenses. So if there are any expenses that the individual pays out of pocket that is related to their disability and they need it in order to go to work, that could be an impairment-related work expense, such as payments for medication or co-payments for a doctor's appointment, specialized transportation. So those things like that, and as well as others, could be considered expenses that Social Security will deduct, and at the end of each month, they'll determine whether or not this person has earned over SGA. So again, for those 3 years, the beneficiary can either get a check or not get a check, dependent upon what their countable income is for that month. After the 3 years are over, if the beneficiary is still earning over SGA, that is when the benefit is terminated. Okay? If they are working under SGA, they will continue to receive their SSDI check. But even yet, there is still one safety net available to them, an additional phase, which is called expedited reinstatement of benefits. If the individual, for some reason, but if they lose their job due to their disability, they are still able to request expedited reinstatement of their benefits to Social Security. Social Security will give them 6 provisional payments, 6 months of payments while they conduct another medical review. And if approved, they will get their benefits back. It's like a speedy application.
But that's the key.
Huh?
The key to all this to me is that secondary review. And you're trying to do everything you can.
Mm-hmm.
And we know, for example, like with bipolar, that illness comes in cycles and seasons.
Right.
And so you might be doing everything you can for several years.
Mm-hmm.
No fault of your own due to the illness.
Mm-hmm.
You've been trying to do everything you can. You're working.
Mm-hmm.
And then you go, and then you get too sick to work.
Right.
Try to go through this expedited process.
Mm-hmm.
But then then you're at the mercy of the judge deciding whether or not you're still ill or disabled. I mean, to me, that's
Yeah.
just like the whole, you don't, so it's the vagaries, it's the whim of a particular court proceeding, whether or not you're able to get reinstated. To me, that's like the whole crux of this, I don't know that there's any way around that, right?
Well, so technically with expedited reinstatement, in order for it to get approved, you do have to be able to show that the reason why you're no longer working is related to the disability. Right. So you gave a perfect example with bipolar disorder, where we do know that it goes in cycles and people can be fine for years and then through no fault of their own, symptoms increase again. So let's say you go to work and you're manic and you get really agitated and you tell your boss where to stick it and he fires you. When you go before that, when you file for expedited reinstatement, you will be able to explain or have the opportunity to explain that, and then they should see that you will explain how that is related to your disability. I was manic, this is what happened. And that is the perfect example of why somebody can have the reinstatement. Now, if somebody gets a job at Circuit City and that goes out of business, Radio Shack and that goes out of business, and what's the other big chain store that just closed down?
Toys R Us.
Toys R Us,
Yeah.
and that goes out of business, right? That's bad luck, but that's not related to a disability.
Right.
So that's not going to count for expedited reinstatement. As long as it is something that is related to the disability and you can demonstrate it, that should be enough to get the approval.
So there's 2 vagaries. In other words, things that are uncertain and you can't predict. One is the mental state of the judge, the disposition of the judge, whether he's a fair judge or not. I mean, situational. The other one would be the economy, because you could lose your employment, and then you happen to be in a position then where, in a recession, I'm just trying to think through, like,
Right.
why would I give up? It's
Sure.
back to the healthcare, because our healthcare system's so screwed up.
Sure.
A lot of people can't afford that risk.
Sure, absolutely. In the interest of time, we are going to go ahead and move on. You're certainly welcome to continue this conversation with us afterwards, because I do get what you're saying, and it is very uncertain, and it is a risk. And with some supports and resources that we will hopefully have some time to talk about, we can help to have people in place to help manage that sort of risk. Okay? Sorry to cut you off, but.
No problem. So as you mentioned, they're afraid of losing their health care benefits. If a person loses or stops getting their SSDI check because of work, they're still going to continue to receive Medicare benefits. They're going to continue to receive them for at least 93 months, which adds up to 7 years and 9 months after their trial work period has ended. And even then, there's other methods of getting continuation of Medicare. Now let's go over SSI. As I mentioned earlier, SSI is supplemental income and has different rules as well. The maximum amount that anyone on SSI can receive is $771 per month in 2019. So each year, the number changes. With SSI, there's a seesaw effect. As soon as the individual starts to work, that SSI check is going to reduce. The good thing is that Social Security does not count the individual's income dollar per dollar. When the person reports their income at the end of each month, Social Security will actually only count less than half of their income. So if the individual earns $800, Social Security will count less than $400 when trying to determine how much they're going to reduce their check by. And that is the amount that they will subtract from their SSI check. And also with SSI, the person can continue to receive Medicaid if they are no longer receiving an SSI check. So if they get to the point that they are no longer getting an SSI check because of work, there is a provision called 1619B, which allows them to continue receiving Medicaid, and they're actually still enrolled in SSI benefits. Their status is just suspended because of excess income. They still have some requirements they need to meet. Their income has to be under $40,869 for the year. They still must meet Social Security's medical criteria of disability, and they must need Medicaid in order to work. Another thing that's not up here is that they still have to meet that $2,000 resource limit. So even though they're working, they cannot have more than $2,000 in their bank account. But I'll tell you guys a way where they can save money without it affecting their benefits in a little bit. Now with both, it is very, very, very important that they are reporting their income to Social Security. Like, how many of you guys have heard Social Security already knows because they're taking it out of my check? So I hear that all the time, and that's not true. Social Security does not know right away, at least, that the person is working. Income must be reported by the 6th of each month. And this is, basically to stop overpayments. If Social Security does not know that the individual is working, if they have SSI, they will continue to receive the full SSI check. And next thing you know, they have an overpayment of $10,000. So it's very important that Social Security knows that the individual is working. For Title II benefits, they're not going to accurately document if they've used any of their work incentives. So again, there's multiple ways that the individual can report their wages to Social Security. One of the ways is going in person to the local office. They can, call by phone. There's a application that they can download to their smartphone, and now you can even do it online through there's an account that you can open, My Social Security. Now there's a portal in there where you can report for both SSI or SSDI your wages every single month. But first, before they do that, they have to call Social Security and give them all the information about their employer, and then after that, they can report online. Now, I'm going to tell you guys about 2 neat programs available. The first one is called Employed Individuals with Disabilities. This is a way to buy into Medicaid. If the individual loses eligibility to Medicaid through SSI, maybe they didn't meet the resource limit, or they have too much income and are earning over that $40,000 amount, they can buy into Medicaid. There is a small fee, anywhere between $0 to $55. It's dependent upon their income. Another way you can use this is if they have Medicare, Part B has a premium of $135.50. Part D also has a premium depending on which plan they pick. If they buy into Medicaid, Medicaid will pay those premiums. And they only have to pay somewhere between $0 to $55, which is a lot better than paying almost $200. Now, I did say their income, I'm sorry, I didn't say. Their countable income has to be below $36,180. Now, this is countable income, and they use a calculation similar to SSI, so that means they're counting less than half of the individual's income. So that's a lot of money that they can earn and still be eligible for this program.
So real fast before we move on to the next slide. It is 12:19,
Okay.
and we're supposed to be done at 12:20, right? Okay, so lunch is next. We will keep going, but I understand people may be hungry, so certainly we are not going to be upset or offended if you roll out to go to lunch. I did just want to let you know there are handouts up here. There's a brochure that goes through some work incentives that Mabel is talking about. There's a brochure that talks about work and recovery. There's one that talks about how to access the Ticket to Work program, or our employment network, the Maryland Employment Network, and there's a resource sheet that gives information on how to access certain resources across the state of Maryland. So if you'd like to go ahead and go to lunch, feel free. You're not going to hurt our feelings. If you want to stop and grab some brochures and resources on your way out, I wanted to make sure everybody knew that those were up here to go ahead and take some.
Maybe we can take like 2 or 3 questions.
Okay.
That, that somebody in the group can ask, and maybe that would tap into some new ways that,
Yeah, that.
then we can go into lunch.
Yeah. Yeah, that sounds good.
Let me just go into the ABLE account really quick, because I think it's really important for you guys to know about. Earlier, I mentioned that with SSI, there's a $2,000 resource limit. Now, the ABLE account is a bank account that individuals with disabilities can open online. They'll be eligible if their disability started prior to the age of 26. But in this account, they can save up to $15,000 a year and $100,000 max in their lifetime before it's counted as a resource through Social Security. So that is a way to get around that $2,000 resource limit that SSI has. So SSDI does not have a resource limit, but there are like Medicare savings programs that have resource limits. So you can't have, I think, more than 7,000.
Yeah, something like that.
7,000 something to continue to receive that benefit. So for purposes of that, you can get the ABLE account. So if the individual has any benefits that has a resource limit, they can utilize this.
So the individual would be the account holder. What do you mean by trustee? Like somebody in charge of distributing it?
My son would not be able to manage an equal account.
Sure. Okay. Yes. You could be on the account to assist him with that. Yeah.
And there's third party, there's 2 third-party trust funds
Yeah.
that have,
Yeah.
Maryland First, the Special Needs Trust would be
Yeah.
right there.
All right. So a couple questions. Anybody? Yes.
So I feel like the heart of this is towards our individual that we're interested in getting some kind of help with employment.
Yeah, let's skip ahead a couple slides and we will talk about that real fast. All right, a couple different things we can do here. Supported employment programs, I've mentioned those several times. There are providers across the state of Maryland who offer individualized assistance. You mentioned you work at Way Station CEP Supported Employment or CEP program, right? Okay, so these programs offer one-on-one assistance that involves assistance with resumes, interviews, filling out applications online, advocating to an employer, that sort of thing. Then once that individual gets a job, they can continue to receive that support to make sure that they are able to maintain that. Because again, as we've talked about, we know that a lot of mental illness can be cyclical. So you might be fine for several months, but then need help to keep the job. So American Job Center is a resource that's available, but they are not tailored to someone with a mental illness. Supported employment programs, they also exist in the intellectual disability world, but we're going to talk about supported employment for mental illness. They are tailored to individuals who have a mental illness. So the staff who are working on that, or working in that program, have experience or education in psychiatric rehabilitation, and they are able to help someone or understand that when I have trouble getting out of bed in the morning, it's not that I'm being difficult, it's that I'm depressed and I'm having trouble managing that. On the handout here that we have, the way to find your nearest supported employment program is to get in touch with your local behavioral health authority. Every jurisdiction, every county, and Baltimore City have a local behavioral health authority, and they are able to point people in the direction of services. They are able to talk about eligibility criteria. As I mentioned, for supported employment, the diagnostic eligibility criteria is bipolar disorder, major depression, schizophrenia, and all of their kind of offshoots or modifications, as well as borderline personality disorder. To find your local behavioral health authority, you can go to marylandbehavioralhealth.org, put in where you live, and then it'll show you what your local behavioral health authority is, or CSA, sometimes they're called core service agencies. You can call them up and explain, hey, I'm working with someone, or my son, or whomever, they could benefit from supported employment. So could you let me know what the supported employment programs are in my area? Additionally, the Maryland Employment Network, which is where we work, we provide assistance with referral and navigation. So if you're having trouble with the local behavioral health authority, you just want somebody to give you a quick answer or even make the referral for you, you can go to our website, which is tickettoworkmd.org, or our phone number is on this handout at the bottom. Give us a call. You'll talk to someone named Molly. She is the nicest person on the face of the earth, and she will point you in the direction of well, first of all, she'll help you determine if you're eligible for a supported employment program, and then she will point you in the direction of one in your area. So there's two ways to find out what's in your area. Also, you could go to SAMHSA's website. They list them out, but these are two easy ways, both local to Maryland, so we're really in the know on what's available. Did that answer your question? And maybe one more? Yes?
We come across a lot of times at our agency where our clients are denied maybe 2 or 3 times. Is that a rule? Because that tends to happen for the majority of them. And is it something that we can advise in that process?
So it's not a rule, as in it's not in a rule book. That's certainly something. That's certainly not something that they're ever going to put in writing. We do see that a lot with mental illness, and the reason is because we've talked a little bit about already how it's somewhat subjective. So the person that isn't responsible for determining that may say, well, Keirstyn's inability to get out of bed is because she's lazy, not because she's depressed, and that may say that may be a reason why I don't get approved. However, they said there are doctors involved in this and that sort of thing. So maybe I'm being a little, snarky. As opposed to a physical disability where if I break both of my legs in a motorcycle accident, that's pretty clear. I don't ride motorcycles, by the way. I've never been on one. But that would be pretty clear that it would be difficult for me to get to work if I've got 2 broken legs. So the reason is just because it's a little bit subjective. My advice would be to persist, keep calm and carry on. That is probably the biggest reason why our folks are so afraid to even consider losing benefits, because it took me 5 years and 3 tries to get the benefit in the first place. Why would I risk that? I get it, man. That's ridiculous. As far as what you're able to do to assist, always make sure they have the notifications, they go to the appointments that Social Security sets up, send in the documentation that Social Security requests. I had one other one and it slipped out of my head that quickly. Be proactive in sending in things if you can. So, when doing the application, it says like, if you have documentation of this, send it in. Don't just be like, well, it says if, so I'm not going to do it. Like, actually send it. You know what I mean? Being proactive and persistent are probably the easiest things. Do you have anything to add on that? Because
No,
I know you're, yeah.
Covered it, yeah.
Yeah. So.
So thank you, everyone.
Yeah.
The slides will be available on the NAMI Maryland website, so that's another way, and I'm sure they'll have their email addresses.
Yes, I will put up our contact information so that you can take a picture of it too if you want to know. A lot of people like to take pictures.
Well, we had a lot more to go.
I know, we had so much more to go. It's because I ramble. Oh my God, there's a bonus round.
That was all me.
I love that little picture. Okay. Here's our contact information. If you'd like to take a picture of that, certainly feel free to reach out to either one of us. Maryland Employment Network's phone number is there as well. Oh, I'm sorry. There we go. Uh-huh. You guys were fantastic. Thank you for being interactive. It's
coming and
always more
listening.
fun to present to an